First, let's look at what you'll need. For intramuscular injection, you will need your B12 ampule, a syringe with a 1-inch needle. Do not use insulin needles for intramuscular injection. They are for subcutaneous injection only. You'll also need alcohol wipes to clean the ampule and the injection site, gauze to protect your hands when opening the ampule, a dressing to cover the injection site, and a sharps container to dispose of any needles and other sharp items. Let's begin. First and very important, wash your hands thoroughly with clean soapy water. Next, you need to prime the syringe. This is done by pulling back and forth on the plunger of the syringe to ensure that it is moving freely in the barrel. Take the ampule and check to see which type of indicator is on it. In this case, the ampule has a line. Take an alcohol wipe and clean the entire ampule starting at the neck. Don't forget to flick the top of the ampule with your finger to make sure that all of the liquid is in the bottom chamber. Wrap a piece of gauze around the top of the ampule and another piece around the bottom. Make sure there are a few layers of gauze. This is done to protect your fingers in the event that the ampule breaks. With your thumbs pointing inwards and as close as possible to the neck, push away from you with some force and the top should snap off cleanly. Ampules with lines and no indicator often require the ampule to be rotated to find the weak spot. Then dispose of the top in your sharps bin. Carefully remove the needle cap from the syringe. Insert the needle into the ampule and pull back on the plunger. Tilt the ampule to the side to ensure that you take up all of the liquid required for your dose, but be careful not to tilt it too far or you will lose the liquid. Put the empty ampule in the sharps bin. Pull back on the plunger to remove any liquid from the needle. Then tap the side of the syringe with your finger to remove any air bubbles that may be in the syringe. In this demonstration, we are holding the gauze behind the syringe to show you the liquid coming out when we prepare the needle. You do not need to do this step and should always make sure nothing touches the needle. Push the plunger up until a small amount of liquid comes out of the needle. Then carefully replace the needle cap at all times, making sure you do not touch the needle. If you touch the needle with anything other than the needle cap and the side of the ampule bottle, discard it and start again, as the needle will be contaminated. Locate the injection site for intramuscular injection, which is shown in red in the diagram. It may be in the thigh, the deltoid muscle in the upper arm, or the buttocks. In this demonstration, we will be injecting into the thigh muscle. Firstly, never inject in the top of the thigh or the inner thigh. You need to inject a little to the outer side of the thigh. You also need to make sure you inject into the correct area. You can find this by measuring down your leg with your hand. From the hip bone to the knee, you will have 3 hand spans. The injection area should be within the middle hand span. Clean the injection site with a new alcohol wipe, starting at the point of injection in a circular motion, working outwards. Now you're ready to inject. It is important for intramuscular injections that you inject on a 90-degree angle. Carefully remove the needle cap. You can either pinch and bunch up the skin or flatten the skin out. Use the same manner as you would if you were throwing a dart to insert the needle into the muscle, making sure you hold the syringe at all times. Do not let go. Before you start injecting, you must aspirate the needle. Do this by pulling back on the plunger a little. Make sure there is no blood present in the needle chamber. If there is, you must remove the needle and start again with a new syringe and new B12. Slowly press down on the plunger. Do not inject too quickly or you may damage the muscle tissue. In addition, some types of B12, such as hydroxycobalamin, may cause some minor stinging as you inject, so it's best to inject slowly. Remove the needle from the muscle by pulling it out at the same 90-degree angle that it went in. Then with an alcohol wipe, massage the area to disperse the B12. Then place a dressing, such as a Band-Aid, over the injection site and dispose of all sharps in the sharps container.